Hi, it's Dr. Epstein. I want to show a patient who's had a procedure that I do fairly frequently, which is the use of body hair, namely in this patient's case primarily chest, although we may take some back hair, but we also use beard hair sometimes. But anyway, it's a chest hair transplant from the chest to the scalp. And this is primarily for patients who've had prior strip procedures. This gentleman had work done many years ago in California. And I've done some work on him after that using scalp hair transplants. And then around 2 years ago, we did a body hair transplant, taking hair from the chest, which he's got a lot of, to go ahead and restore density. And let me show you, basically the area we get the chest hair from is, usually we go, and you can see it's pretty dark hair. We go ahead and we'll go ahead and take it from this area. Basically, we like to, I'll mark out the areas where the hairs are best. And in this case, most of these hairs are darker. And usually I like to avoid going into the belly, although sometimes we will. That just tends to be healing, tends to be a little longer there. But we'll focus on going ahead and doing the chest region. Here. You see he's already had a procedure. If you look very close, I don't know if you can see very tiny white dots where his prior hairs were extracted. But even when guys go ahead and shave their chest, it doesn't even show. He does have a little bit of hair on his back as well. And anyway, the areas we're going to place the hairs today is throughout here. What I typically find with body hair grafts is it doesn't go ahead and necessarily make it look really thick, but it definitely makes an improvement. And you've seen an improvement from your last procedure?
Yes.
Yeah, so what it does is basically goes ahead and we restore it, just even though they're mostly single hairs, some are doubles, and they will grow just like scalp hairs. They'll just continue to grow, which is awesome because they'll blend in nicely and they become softer, probably due to the fact that the blood supply is better on the scalp than it is on the chest. Anyway, this is Dr. Epstein showing the patient who has had and will be having again today a body hair to scalp hair transplant. Thank you very much.